Ready?
Mm-hmm.
Just say ready.
Ready.
Hello everybody, this is Dr. Ernst von Schwarz. I want to thank Paul very much for inviting me to be part of this seminar on stem cell therapy and research. I have to apologize, first of all, that I can't be live with you guys. That's why I'm recording this. Actually, it's on the same day, but unfortunately I have a procedure later today. So hello everybody, and allow me to talk a little bit about stem cell research and therapy, what we are doing. So I don't want to go too much in details, but briefly, in my opinion, stem cell therapy is the future of modern medicine. There's no doubt about that. We have immense data now in the published literature demonstrating the enormous potential of stem cells to regenerate damaged tissue. That's why we came up with that term regenerative medicine, which means basically repair of damaged things. And that repair, that regeneration plays a major role in the treatment of a large variety of different conditions, in particular those which have to do with what we call age-related degeneration. So advanced age goes hand in hand with a multitude of different diseases, in particular cardiovascular diseases, neurodegenerative diseases, and musculoskeletal diseases. So this is where stem cells have an enormous potential by treating those vascular conditions, by helping those with neurodegenerative conditions such as Parkinson's after strokes, after heart attacks, and also people suffering from musculoskeletal conditions such as chronic arthritis in the knees, in the shoulders, in the hips, you name it. So the basic idea of regenerative medicine is basically to, number one, improve symptoms, number two, reduce pain, and number three, improve mobility and avoid frailty, in particular among the elderly. That's where regenerative therapy with stem cell therapy comes in. And that's where it has been studied the most. So, on the other hand, you all know that at the current time, stem cell therapy is not FDA approved. None of them. No matter what different labs might tell you that, oh, this is approved and this is okay to do. No, definitely it is not FDA approved. It is, and at the current time remains, considered experimental in nature. That does not mean if someone is not FDA approved that we are not allowed to do it. We just have to be careful how we do it and what exactly we are doing. So this prompted me a while ago to write two big books, which I have in front of me here. And I don't want to just do advertising for myself here, but I do encourage you guys, read this book, The Secret World of Stem Cell Therapy, which is the only comprehensive overview of what is known about stem cells. And this is not so much for you guys as professionals, this is more for your patients. And I give this to my patients all the time. And it's not an advertising for stem cell therapy, it's just the opposite. It's a warning. Do not believe Dr. Google, and do not believe what many people tell you. So if you Google, let's say, stem cell therapy for heart disease today, you get within 0.01 seconds like 84 million hits. And if you look at those hits, what comes up on an internet search on stem cell therapy for heart disease, as one example, 99.99% is pure marketing and advertising, not scientific facts. So it's paid advertising and it's marketing. There's not much there. So the first thing what comes up is from a clinic somewhere in the middle of nowhere where they claim, oh, we are the greatest and the best and the world expert in stem cell therapy for heart disease. Interestingly, nobody has ever heard about the guy. He's never published anything in his life, and it's all advertising. The second thing which comes up on a Google search is an FDA warning, and the third thing is legit, an article from the Mayo Clinic. So you have to be very careful what you tell patients, and don't believe what is posted on Google or any other internet sources, of course. So that's why I wrote this book, to tell patients what are really the facts, what is known scientifically about stem cells and the therapy and the clinical studies which have been done, but also what questions to ask. And that's very, very important. Where do the cells come from? What are the cells, basically? And there's a large number of different labs in this country. They sell you cells, and every lab tells you, oh, we are FDA approved and we have INDs. In most cases, that's actually not true. It is and remains experimental in nature, and nothing has been approved. But what are the legalities now? What do we as physicians, as practitioners, need to know if we want to help our patients? Because we know stem cells help. I have done hundreds of patients with arthritis and injected them in the knee, and they were pain-free. Several patients with heart disease which improved, and in particular recently, over the last couple of years, we had so many patients with neurodegenerative diseases, from Parkinson's to multiple sclerosis to after cardiovascular accidents in the brain, with significant improvement. But as you all know, there is no cure of any of those diseases using stem cells or anything else at the current time. But coming back, what are the legalities? That's why I wrote a second book, which just came out a couple of months ago. And that's not for the patient, that's not for the consumers, that's for you guys and us. So for the physicians, for the healthcare professionals who are interested in the stem cells. And that's called The Ethics of Modern Stem Cell Research and Therapy. And it's not only about ethics. I'm a bioethicist, but it's not only about that. And it's also about the religion. For example, people tell me, sometimes patients tell me, oh, yeah, no, the Catholic Church does not allow stem cell therapy. That's actually poppycock. That's complete nonsense. The Catholic Church supports stem cell research and therapy, except embryonic derived stem cells, because that would require to destroy an embryo, kill alive. And I'm completely against this as a Catholic. But besides that, I have here also written in different chapters and portions of the book everything you need to know about the legislator, about the FDA designation of 351, 361, about all the lawsuits which have been filed so far against stem cell treatments. And by the way, what do you think? Who filed the lawsuits? Not patients, rarely patients. It's mainly district attorneys, because number one, it doesn't cost them anything. Number two, they use it for their political forthcoming and for their careers, basically, to make themselves a name, because it's easy for district attorney to sue stem cell clinics. And the reason why clinics were sued or are closed even by the FDA is very, very simple to know. The number one reason is false claims. Just maybe a month ago, clinics in the state of Georgia were closed because they made false claims. They said, oh, stem cell therapy is as good as surgery. Well, it might be even better as surgery, but are we allowed to say that? Absolutely not, because we don't have any scientific proof. So you cannot make false claims for any cure of any disease. I tell every single of my patients who is interested in stem cell therapy, and I repeat that over and over again. It's not FDA approved, it's not covered by any insurance. We are doing it in a clinical trial frame, but those trials at the current time are patient sponsored, so they're not sponsored by any industrial partner, because we don't have those. But patients have to pay for it, but still are in a trial. It is considered experimental, and there is no guarantee for success. I quote oftentimes the published studies which have shown benefits for whatever condition. And if you look in the literature, every single study which ever has been conducted trying stem cells for, let's say, arthritis or after heart attacks or after strokes or other conditions, have shown significant benefits. So it is very promising, but you have to be careful what claims, if any, you make. And I always repeat myself and tell my patients, there is no cure for your condition, but from the data from the scientific literature, we believe that there might be some improvement, possibly some delay in the progression of the underlying disease, in particular for conditions like Parkinson's and multiple sclerosis. And there can oftentimes, not always, but oftentimes there can be improvement of symptoms and reduction of pain with improvement of mobility. So having said that, this is the number one thing. So you have to basically keep in mind what you tell the patient, and don't make false claims, and don't put any claims on your social media, and don't put any anecdotal patient testimonials on your websites, because that's actually not allowed. It's not allowed. We did that years ago too. We didn't know. The FDA basically does not allow that. Don't ask me why. It is what it is. Anyhow, it will probably take another 5, if not 10 years before we have larger, more robust studies available, which might then help the FDA to decide if for a particular condition, a particular stem cell product might be able to be approved. So we are in the process of developing and performing larger scale clinical trials with one particular product for one particular condition. I do not believe that there is like a miracle drug, one fits for all. I'm not a fan of that. I think if we treat someone with hair loss, we might go well with exosomes, whereas if we treat someone with advanced stages of multiple sclerosis, they're most likely better off with a combination of umbilical cord, Wharton's jelly, and other substances in it. So whatever you use, make sure you know what it is, what the material is. And people always ask about the CCs. The CCs really doesn't matter much. It's more the content, what is in your materials. The other thing is, of course, and I wrote extensively about this in both books actually, is unfortunately the quality of many labs in this country, and worse outside this country, is way below standards. That's why it's not surprising that a couple of years ago, from one particular lab here in Southern California, 18 patients who received their product all over the country ended up in ERs and hospitals all over the nation because of infections, whether it was septic arthritis from an injection in a joint, or whether it was systemic infection after systemic administration, meaning IV injection or infusion of stem cells from that particular company. And it came out that their products were contaminated with E. coli. I've seen that from other countries, from other companies, from other manufacturers. And unfortunately, like I said, the quality of those labs is horrible. It's atrocious in this country. And there is not many ways how to find out. I was part of a lawsuit as an expert witness recently, where the other side said, well, the doctor, it was his job to find out if that lab is legit and if they do the right thing and the samples are not contaminated. That's complete nonsense. I mean, we as physicians, we cannot look at the vial and say, oh no, that looks clean. That's nonsense. So we are relying basically what the labs tell us. But not all labs do the right thing, and the ones I mentioned here in Southern California, for example, they are crooks in my opinion. They did not even have a physician, they didn't have a biochemist, but just business people who want to make money out of that. So for that particular reason, I'm only working with 1 or 2 or maximum 3 labs, and Thomas being one of them, of course, because we know them since many, many years. And we never had an issue with any infection, with any contamination, or with any other quality issues. But of course, ask questions, because we are the ones treating patients. So I don't want to sound too negative altogether, of course, just the opposite. I want to encourage you to look into the research of stem cell therapy because, like I said at the beginning, it's the future of modern medicine. And I have seen enormous results in patients of all ages. We published a couple of studies. We were the first in the world publishing a COVID study using a single stem cell injection versus placebo. Actually, we paid for it, the patients didn't pay for that, with standard therapy. And even though that study was a single center, small scale study, and it was not powered to evaluate mortality, there was a significant reduction in the number of deaths in those patients who received a stem cell shot compared to the standard therapy. And there was improvement of overall morbidity. So again, it was a very small study, but it was double-blind, placebo-controlled, and it showed us enormous results. And others have verified that. A study from China has shown the same thing. That was at the beginning of COVID, when people really died one after the other like flies because of COVID and before the vaccinations. But it showed us the enormous potential anti-inflammatory power of the stem cells. And now we are treating mainly chronic degenerative conditions, as I mentioned earlier, and I see enormous successes. And in the future, maybe stem cells will replace certain surgeries, like knee replacement, hip replacement surgeries, or might become an alternative to surgeries in people with high morbidity and higher perioperative risks. So, altogether, the stem cells is the future. Be careful what you claim, don't make false claims, make sure patients sign informed consents and they understand what they are signing. They have to understand that it is experimental, it's not FDA approved, it's not covered by insurances, and there's no guarantee for success. But we need to come all together and gather all our data in order to show them to the FDA, to analyze them scientifically first, of course, publish those data, and then go the next step. So, best of luck. If you guys need any support, any questions, please refer to Paul. And Paul, you can of course forward my contacts. My website is www.drvonschwarz.com. I'm reachable via email all the time. All the best. Thank you for your attention. Best of luck.